Hello, I'm Robin Gill. We're standing by for the Prime Minister to address Canadians about the COVID-19 pandemic. Justin Trudeau has been in self-isolation since March 12th and has been speaking from Rideau College each day. His wife, Sophie, tested positive for COVID-19 on March 13th. She's recovering and is doing well. Tomorrow, the House of Commons will reconvene in order to pass emergency legislation to help fight this pandemic. We can tell you now, the number of confirmed COVID-19 cases has risen. The number is recorded every day and growing each day. There are now 1,400 confirmed cases in this country. The majority remain in BC and Ontario. That province is reporting more than 70 new cases in the last 24 hours, bringing the total in Ontario to 503. Quebec and Alberta are both over 200 cases. Here's how the rest of the country looks, with Yukon reporting its first cases yesterday. A couple recently visited the U.S. The regional chief medical officer there is now recommending everyone avoid non-essential travel into and out of Yukon. Let's bring in Mike Couture in Ottawa. Mike, we know that there's a special session of the House of Commons tomorrow, but not all MPs can get there.
Yeah, and not all are welcome, frankly. They already agreed to this before suspending Parliament. It feels like it was a year ago, but only a couple of weeks ago. And they said that, look, we'll have a pared down Parliament, enough to have quorum. I'm hearing from at least one source that it'll be proportionate to their representation in the House of Commons. Hearing that there'll be 15 Liberals, not many cabinet ministers in that group, though, because they will have cabinet meetings, and for any kind of vote, they have to be in there. They can't break away from cabinet. We're hearing there'll be 11 Conservatives, which will include Conservative interim leader Andrew Scheer and Candice Bergen, the House leader for the Conservatives. We're hearing David Akin has reported that a government aircraft has gone to get both Andrew Scheer and Candice Bergen in their respective cities. They will be brought, obviously, to Ottawa. Then you'll have, we believe, 3 NDPers. Unclear how many from the Bloc will be coming. Obviously, they can probably drive, so it'll be easier. And we're hearing that the Green Party candidate, not the candidate, but the member, Jenica Atwin, who is from New Brunswick, has actually started driving to Ottawa to be here in time for tomorrow to have a Green Party representative in the House of Commons. What we have also heard from the Conservatives, Andrew Scheer was making the rounds yesterday, saying that he's not going to stand in the way of this $82 billion emergency stimulus package. In fact, he's working hand in glove with the government to make sure that if they see any gaps in it, that if the opposition parties see any gaps that they can identify, that they will make these suggestions through the regular backroom channels and talk to, through House leaders, one from the Conservatives, one from the Liberals, and they're not looking to score political points here. This is a change in tone, considering that what you had even just a couple of weeks ago, where there were some members of the Conservative Party who were saying, look, we are in a really bad situation. This is the rainy day that we needed the rainy day fund for, that the Liberals have spent the cupboard bare. A definite change in tone, realizing that this is getting all the more serious and that they need to have a more collaborative approach with this government. We're also hearing, I heard from a source today, that what we expect from Prime Minister Trudeau today is another announcement of funding for research into a vaccine. So we had heard on March 6th that there was $27 million that was announced by this government to try and get universities and researchers together to try and find a vaccine and also look at different ways of testing. They are obviously ramping up that effort, so expect that to be coming in the next few moments. Already there's been 47 research teams that have been looking at this, but because of what we're seeing across the globe, Canada wants to be a leader here. They want to make sure that our teams, that our specialists in this can contribute to this. And, expecting also that the Prime Minister will have any kind of update on the repatriation flights. We've heard from Canadians across the globe saying they are concerned that they won't be able to get home. There was a flight that arrived Saturday evening from Morocco to Montreal. Another one is supposed to leave today. A third will leave on Wednesday. Just this morning, François-Philippe Champagne, the Foreign Affairs Minister, was tweeting that there will be more flights that are being operated, 3 from Peru in the next few days. It's interesting, we had him as a guest on the West Block in this very studio just yesterday morning, speaking to him about it. And just before we started the interview, he said, I need my phone right beside me because I'm expecting calls from different foreign affairs ministers in different countries, Spain, Peru, and Morocco. So I'm going to have to stop this interview if I get a call from them right now. And of course, we said, of course, I think getting Canadians home is a little more important than the interview that we have to do. But he is on the phone and constantly connected to his counterparts from across the globe, trying to make sure that he gets Canadians back to Canada, those who can get to an airport. He also mentioned that he's in constant communication with his counterpart in the UK and making sure that there is almost a constant flight going back and forth from London to make sure that if we have to repatriate Canadians from Europe, that they can get to London and then come back to Canada. It's really an all-of-government effort, and they are continuing this 24 hours a day, 7 days a week, Robin.
All right, thanks for that, Mike. We're going to go to our Ottawa Bureau Chief, Mercedes Stevenson. Mercedes, there seems to be this real race to get a vaccine.
Yeah, Robin, obviously there is a hope that, imagine if you could find that vaccine and if you could not only slow the infections down, but stop them so that people who received it were not vulnerable. If you could create what scientists call and doctors call herd immunity, where the idea is that the more immunity you have among large populations, the less the vulnerable are exposed. So they're certainly racing towards that. They're looking at chloroquinines as a form of treatment as well. Some of our viewers might remember that, and some of the folks out there who've served in the military. It's an anti-malaria drug. It's a very controversial one. The Canadian military very rarely uses it anymore because it can cause a lot of side effects. But when they're looking at the potential side effects of a chloroquinine versus people potentially dying, they are seriously looking at that in trials now as to whether or not that can help. There is this race on to try to do as much as possible to try to prevent the spread. Number one, of course, is social distancing. That's what everyone's talking about. That's where I am right now at home. I'm in self-isolation, Robin, because I was down in the U.S. And so we are coming to you live from my living room. And this becomes the new normal for people. And they're saying, look, this is not something that's going to be days or weeks. Hunker down. It could be months. Get used to it. There are other ways to connect with people. But this really is important. And in fact, it's so important that the federal government is saying if people can't listen or don't listen, not only are provinces bringing in enforcement rules to force people to stay home, there is the possibility the federal government could look at serious consequences, including fines and criminal charges. And beyond that, there's the possibility they can, and this is a very remote possibility, but they can, Robin, call the military in to do quarantine enforcement.
Mercedes, we've been talking about the pandemic plan, and that's what they've been sort of basing their plan on. Are you getting any sense of what the military is doing?
Actually just speaking with somebody very senior in the military, literally as you were speaking to Mike there to get the latest update. And they're planning a whole lot of things. And the military are great planners. That's what they do. There's always a unit on standby in the Canadian Forces that's ready to go in the case of an emergency. And those are the people we've seen fighting forest fires and dealing with floods. They could also be used for this pandemic if the government makes a request or if the provinces make a request. Now, the number one thing they expect they could be doing is medical help. And we saw that even on the flights coming home, repatriating Canadians, where there were Canadian military medical staff on board. There's also logistics. They're really good at moving people and managing people. If you have large numbers of sick people or you have to get goods to remote places, they're the people that know how to do it. They also are able to treat people in a larger scale because there's a lot of them, and they've canceled exercises, including the Army's biggest annual exercise with almost 5,000 people, to make sure that they don't have all their resources concentrated in one place. They are at home. They are on sort of the minimum staffing they can do while still doing all their critical jobs to make sure people aren't exposed in the workplace. But the military absolutely is coming up with a plan for the full range of scenarios that you can imagine, right up to that quarantine enforcement, hoping they'll never have to use that, hoping that instead they can deploy smaller packages to help. The other thing they have to adjust for here, though, Robin, is the fact that they have that unit on ready, on standby that's always there. But if we start seeing things like spring floods happening at the same time, or firefighters, now they're getting split in two directions. So they're really thinking about all the different possible scenarios they could face here to come up with plans for all of them.
You talked about enforcing quarantines. Yesterday, Nova Scotia introduced strict measures. Newfoundland and Labrador did it last week. Where's the federal government on this?
So yesterday, Patty Hajdu, who's the health minister, came out and said that if people aren't going to listen, then there is the possibility of there being a actual criminal violation considered or a federal fine. I think right now they're relying on the provinces to try to bring in those measures first. But she made it very clear that the federal government has not been impressed with people who aren't listening to what's not just advice or a request to stay at home. They're being told to stay at home. And I think they try to allow for some kind of an adjustment period. But that is a very limited time frame on this, where we're hearing that this week and next week could be two of the biggest weeks from experts in infection control of the spread of that disease. And people are saying, well, I don't feel it. I'm young. I'm healthy. You know what? It doesn't matter how you feel. You can spread it to someone else. And people feel young and healthy until they come down with this virus. So the federal government's saying, look, one person could spread it to dozens of others, not even knowing they have it. Just stay home. Try to limit your going out grocery shopping. Definitely don't gather in large numbers. And that includes outside. So just because it's a beach or a park doesn't mean you should congregate and stand close to other people.
All right, Mercedes, we're going to get back to you. We're going to go back to Mike LeCouture. Mike, Team Canada is saying that it's going to not send its athletes unless Japan delays the Tokyo Olympics.
Yeah, and that is unprecedented when you consider the environment we're in, making that decision, and they saying on their website, look, this is not a sport decision. This is a public health decision at this point. And there's the tweet saying we are all Team Canada, making sure that everybody doubles down on this self-isolation. Consider that athletes, when they train to peak, not only to the amount of time, the month and the week that their event will be competed in, but the day. So they can't get to training grounds right now. There are pools that are closed, there are gyms that are closed, so they can't properly trained. They don't want to send people, and they think that they're trying to get ahead of this. The IOC, for the first time, is talking about postponing the games. So is the Prime Minister of Japan, Shinzo Abe. Amazingly enough, you have Prime Minister Trudeau that on his schedule today is supposed to speak with him. It would be interesting to hear if they will speak about the Olympics. More than likely they will. They are G7 leaders, so I'm sure they're speaking about other things as well as what Japan has done to make sure that they are flattening the curve. But I'll read from you just a tweet from Adam Van Koeverden, who's an MP, a newly minted MP, but also a former kayaker, rower. He says, this is so tough for so many athletes, but this situation is bigger than sport. The health and safety of our athletes, coaches, staff, and fans has got to be top priority. And he's proud of Team Canada for taking this lead. And that, I'm sure, was a difficult decision for them. But the world is also looking at the IOC and kind of saying, what's taking you so long? Because, for them to even say,
just let me
we're not
interrupt here for a second. The
cancellation.
IOC says it has about 4 weeks to make a decision, and yet we're talking about how cases are going to rise in the next little while. So it just doesn't seem to match.
And that's the issue. A lot of people have thought that the IOC has been tone deaf on a lot of issues. Doping is one of them. And athletes have often led the way on that and making sure that they bring the Olympics in the right direction. And perhaps we're seeing another iteration of that where Canada has said, you know what, it doesn't matter what the IOC is going to do. We're also hearing Australia is making that decision to not go to the games, not send their athletes to the games. And perhaps the IOC will be looking at this and they won't have a choice because they won't have enough countries to actually just compete and put on a proper Olympics. In the meantime, from what I understand, the torch relay continues throughout Japan, but you'd have to think that that will stop at some point as well. And the IOC will have to, before that 4-week period, make that decision as to whether or not they postpone or cancel the games altogether, Robin.
This is probably such a tough decision for everyone involved. These athletes have been training for so long, but this is a public health emergency.
Yeah, and those Olympic dreams that they've built for so many years, if you have been practicing a sport, whatever it is, you're training for this moment. And it only comes around every 4 years. So your window of time to win that medal, to compete in the games, and to achieve that dream is so small. But at the same point, we heard Dr. Theresa Tam say our window from flattening this curve is also shrinking. And this is a public health emergency. This is a global public health emergency. To Adam Van Koeverden's point, this is not just about sport anymore. all of the major sports leagues canceled across North America, and you're seeing across the world. And at some point, the IOC, even though these Olympics are scheduled for later in the summer, the IOC is going to have to make that decision sooner rather than later. And as I'd mentioned, you may have it where all of the Olympic committees make the decision for them and basically say, sorry, we're not going. Even if you want to hold an Olympics, just you won't have enough countries.
Just think about the NHL, the NBA. They've canceled everything. We still don't even know what's going to happen with baseball this year, and yet they still seem to be focused on continuing with this.
Yeah, and I think that there's also a public relations aspect to this. And you think about that not only from the different sports leagues, but also from government. You've been hearing from government, this could be weeks, this could be months. Nobody really has an idea of the scope, and I don't think anybody really wants to make a decision that can make the public panic. Think about it. Just yesterday, you had Quebec say schools will be closed until May 1st. That reverberates across the country, and other parents, and I know for myself, I've got 2 kids, and I look at that
Mike,
and go,
you know what? We're going to get back to the Prime Minister is walking up and just about to speak.
Bonjour tout le monde. I want to begin by recognizing that a lot of people have now been stuck at home for a week or more because of COVID-19. If that's starting to take a toll, it's understandable. But we can't afford to stop now. I want to be clear. Social distancing, physical distancing, is the single best way to keep the people around you safe. What does that mean? It means keeping 2 meters between yourself and someone else. It means avoiding groups. It means staying home as much as possible. If you choose to ignore that advice, if you choose to get together with people or go to crowded places, you're not just putting yourself at risk, you're putting others at risk too. Your elderly relative who's in a senior's home, or your friend with a pre-existing condition, our nurses and doctors on the front lines, our workers stocking shelves at a grocery store. They need you to make the right choices. They need you to do your part. We've all seen the pictures online of people who seem to think they're invincible. Well, you're not. Enough is enough. Go home and stay home. This is what we all need to be doing. And we're going to make sure this happens, whether by educating people more on the risks or by enforcing the rules if that's needed. Nothing that could help is off the table. Today, we're launching federal advertising campaigns. You'll see faces that you know and trust, people from our cultural sector getting out the recommendations from our healthcare workers. Not having heard this message won't be an excuse. We're reaching everyone. Listening is your duty, and staying home is your way to serve. Every day, there are more and more people who step up and heed this call. Just yesterday, Team Canada and the Canadian Paralympic team made the tough decision not to send athletes to the Olympic and Paralympic Games this summer. I know this is heartbreaking for so many people, athletes, coaches, staff, and fans. But this was absolutely the right call, and everyone should follow their lead. No matter who you are, if you're doing your part, I want to say thank you. You are saving lives. And when it gets hard, know that your government is right there with you. On Wednesday, we unveiled an $82 billion plan for people and businesses affected by the virus. If you're worried about making ends meet, we're putting more money in your pocket. If you own a small business, we're helping you bridge to better times. Tomorrow, the House of Commons will reconvene to pass emergency legislation and put this plan in motion. For farmers and people across the agri-food business, I know these are hard times too. So we're also opening up $5 billion in additional lending capacity. Starting today, farmers and producers can apply through Farm Credit Canada for the support they need to keep food growing and get it onto our tables. On that note, I want to say thank you to people right across the entire food sector. Day in and day out, you grow, transport, and stock the food that feed our families. Last week, we also announced a plan to mobilize industry so our hospitals have the medical support and equipment they need. Later today, I will have a call with the First Ministers to discuss our continued coordination on quarantine and self-isolation. We're working together to ensure that everyone has what they need, whether that's equipment for testing or medical supplies. This evening, the Premiers and I will also talk about continuing to move forward with measures to support families and small businesses to ensure our economy rebounds. For Canadians stranded abroad, we're working with airlines to get people home. People should be returning by commercial means while they're still available. Air Canada, WestJet, Air Transat, and Sunwing all have flights this week. As of today, we've secured authorizations for Air Canada to operate 3 flights for this week for Canadians in Peru, and there will be 2 more flights in the coming days from Morocco. We've also helped secure an Air Canada flight from Spain, as well as Air Transat flights, including 2 from Honduras and 1 each from Ecuador, El Salvador, and Guatemala. If you're a Canadian abroad, register with the government now so we can send you updates and contact you. You need to do this if you haven't done it already. Depuis le début de cette crise, on utilise tous les outils à notre disposition pour gérer la situation.
In our toolbox to manage the situation. We're very lucky. Canadian innovators are among the best in the world, and they want to be part of the solution. We're investing $275 million in research on COVID-19 and the development of vaccines. Vaccination and antiviral treatments are options that we must look at. We're seeing this with flu vaccines to stop people falling sick. They protect the most vulnerable and to make sure that fewer and fewer people go to the ER. Today, I'm announcing that we'll be investing $192 million to directly support the creation and the production of vaccines here in Canada. We'll be funding a long-term solution against COVID-19 here at home. We'll be signing an agreement with AbCellera of Vancouver to support their work designed to treat and to prevent COVID-19. We're also working with Medicago from Quebec to produce and test vaccines. At the same time, we're also earmarking money to the University of Saskatchewan for the development of vaccines and clinical tests as well. Canada needs the necessary capacity to produce treatments on a mass basis as quickly as possible. We're also investing in the National Research Board in Montreal.
We're providing $192 million to directly support vaccine development and production in Canada. We're investing in a long-term solution to COVID-19 right here at home. Our government will be signing an agreement with Vancouver-based AbCellera to support their work on drugs to prevent and treat COVID-19. We're also working with Quebec City-based Medicago for vaccine testing and production. At the same time, we're providing funding for the University of Saskatchewan's Vaccine and Infectious Disease Organization for development and clinical trials. Once there are promising options, Canada needs the capacity to mass produce treatments as quickly as possible. That's why we're investing in the National Research Council of Canada's facility in Montreal to prepare for the rollout. These are critical steps forward. But we have to remember that vaccines won't be ready overnight. They will take months to develop and test. So while that's happening, we need to work to mitigate the impacts of this virus. And luckily, we have the tools we need right here at home. Blue Dot in Toronto was among the first in the world to identify the spread of COVID-19, coming in 9 days ahead of the World Health Organization's public warning. We've signed a contract to use this Canadian software to model the disease. It will help us track and therefore slow the spread. Minister Baines has also sent a call to action to every university, college, polytechnic, and CEGEP in the country. Their labs have the resources and expertise to be part of this fight. We've asked them to identify equipment they've got, like masks and ventilators. At the same time, we're looking at innovative solutions they can be part of, including 3D printing of medical supplies. Many institutions have already stepped up, and many more will do the same. If you need more information, please go to buyandsell.gc.ca. We need all hands on deck. Nous demandons à chaque université,
we're asking all universities, colleges, and CEGEP across the country to give us all the masks and ventilators they have, or to suggest other ways they might help through 3D printing, for example. Many of these facilities have already stepped up, and many more are thinking about doing so now. For more information, please consult buyandsell.gc.ca. We all have a role to play in the fight against COVID-19. Even if you're not a paramedic or a researcher, you can save lives by staying at home as much as possible, by keeping a distance of at least 2 meters with others if you go out. That makes the whole difference, makes all the difference, rather. That's how we can protect ourselves, our nurses, our physicians, and our healthcare professionals who are taking care of those who need to care. We need to follow the recommendations from our public health agencies. We have to trust them, and we must listen to them. Yesterday, I had a part of my speech where I talked to kids directly. I have a message for our seniors today. We all have loved ones who are at home, who are very, very vulnerable. Call them. Tell them that you love them. I'm thinking myself of my father-in-law, Sophie's father, who's undergoing treatment for cancer and has been for several months. We don't see him very often, but today is his birthday. Happy birthday, Jean-Jean. You're 78 today. Happy birthday. Think of our elders, think of our loved ones, and do everything we can to keep them safe. This is how we will put a break on the spread of COVID-19. Thank you for doing your bit. And please know that our government will continue to work day and night to support you. Together, we will get through this. Thank you very much.
Hi, Mr. Prime Minister. It's Annie Bergeron-Oliver with CTV National News. You said that a vaccine will take months, despite funding and assistance that's being announced today and that the government has already put in place. What immediate and specific actions is the federal government doing to increase testing capabilities and to reduce the testing backlogs that people are facing right across the country? As we said on vaccines, we have moved forward on investing in a number of companies to accelerate their movement towards clinical trials and eventual production of a vaccine. In the meantime, we are increasing our testing capacity every single day. Many companies in Canada are increasing their production. We're working with labs across the country to accelerate the arrival of testing results as well. We recognize that there is a significant load on the system. We are looking at technological and concrete solutions that will accelerate this process, because we recognize that mass testing is a key part of the path forward. Par rapport aux vaccins,
on the issue of vaccines, we're assisting companies who are approaching the clinical test stage to work more quickly, but that's going to take several months, of course. For the time being, we know that testing is essential. We're trying to invest, and we are investing in accelerating production and the availability of tests, but we're also working to expedite or to increase to reduce rather the wait time for results. The system is a bit overloaded, but we have to do more, because we know that testing is an integral part of how we will actually put a break and stop the spread of COVID-19.
Sitting at home right now watching this press conference, who cannot afford to continue paying their rent or for themselves or for their businesses. Why hasn't your government done more to specifically help renters?
Yeah, we know that there are significant pressures on on Canadians right across the country who are facing bills coming in, who are facing pressures on caring for their families. That is why we are working extremely quickly to get money out the door into the pockets of Canadians during this extraordinary time. We recognize there are hundreds of thousands of Canadians out there who are applying for EI benefits online. What we're working through, including with the step of recalling Parliament tomorrow, is a legislative package that will allow us to move forward even quicker on getting money into the pockets of Canadians who need it right across the country.
Bonjour, Monsieur Trudeau, Christian Noël de Radio-Canada.
Hello, Mr. Trudeau, Christian Noël. You mentioned the Olympic Games earlier. Now, your message to Canadians and to athletes, but also to the organizing committee, is it appropriate to organize an international event at this point in time? It looks like it's going to go forward. I know there's a lot of concern about international gatherings. We recognize that Prime Minister Abe of Japan is very, very well aware of the challenge. The Canadian Olympic Committee has decided that we won't attend the Olympic Games this summer, and this was announced yesterday. But I'm encouraging everybody who's thinking about organizing gatherings of thousands of people to not do it. It's important not only here in Canada, but across the rest of the world. Stay home, please. If we look at what's happening here in Canada, people on the internet, for example, seem not to be worried about the virus. They seem to feel invincible. First of all, I'd like to know how shocked you are by this. And secondly, does this mean that the borders or interprovincial borders will have to be closed? Have you talked to premiers about this? Well, of course, we will be talking to the provinces this evening. We have to continue to coordinate our effort, to coordinate our communications as well. Unfortunately, as we've all seen, there are people who seem to feel invincible, who continue to go outside. I understand that the temperatures are warming up. People want to go outside, but it's not the time to do that. You must keep your distance. People must stay at home as much as possible. We're not just talking about our own health. We're talking about putting in danger our seniors' health and endangering our health professionals' health as well. We need to follow the advice from experts, and the advice is that you should stay at home as much as possible. Keep your distance with your neighbours as well.
How exactly will your government enforce social distancing? Can you spell out exactly what that will look like?
We are going to be speaking with the premiers this evening and talking about ways we can coordinate. We recognize that many communities, many provinces have declared states of emergency. They have taken measures to close certain public places. There is more that can be done. There is more that needs to be done around messaging, and that's what we're going to be talking about. But every step of the way, if we see that measures aren't being taken up properly, that aren't being followed, we will look at different measures that could be necessary to enforce these rules. We'd rather not, and we know that millions of Canadians are doing their part, but those who are not doing their part are putting at risk everyone else, including the eventual recovery of our economy and the well-being of millions of Canadians. So we're going to continue to look very carefully at what could be next steps as we move forward.
Can you spell out exactly what kind of enforcement measures you're looking at the national level?
I can tell you that we haven't taken anything off the table, from the Emergencies Act to new measures or existing measures under the Quarantine Act. There are significant tools that are at our disposal. But like I said, we are impressing upon Canadians to do this of their own will, to understand that individuals can and must do their part to keep us all safe and to ensure that we come through this in the best way possible.
Should all provinces and territories close their borders?
I will be speaking with the premiers tonight about measures that we can take as a country to move forward, and I look forward to that conversation.
Prime Minister Ryan Templeton with the National Post. I'm wondering, this week will be the end of your 14-day self-isolation. Are you planning to resume a quasi-public schedule? Are you planning to leave the House?
As many people are, I'm listening to the advice of experts. I recognize that there is still a week to go in my self-isolation, and we're going to continue doing that. Those decisions on what next will be taken in the right way, depending on what public health says. But certainly, I am going to make sure that we continue to follow all recommendations of public health officers, particularly around staying at home wherever possible and self-isolation and social distancing, which means keeping 2 meters apart from each other.
In terms of the messaging, we've seen people at beaches, we've seen people out on trails clustered together, we've seen people out at large parties together. Do you think it's just a question of people not getting the message? Because you're talking a lot about messaging today.
I think people need to get the message that this isn't just about them. This is about their neighbors. This is about vulnerable seniors. This is about health workers who are on the front lines trying to keep us all safe. Canadians can and must do their part to keep us all safe. When we see images of people out enjoying the sunshine in large groups, that is extremely concerning because they are not just putting themselves at risk, they are putting everyone else at risk. We need to slow and stop the spread of this virus if we are going to come through this strongly as a country without losing too many of our loved ones. Every single Canadian has a responsibility to engage in keeping their distance, in staying home whatever possible, and ensuring that those who have to go out for essential services and to keep us healthy and alive and fed are not at risk themselves.
Well, I think it's frustrating for many Canadians who are stuck at home. It's very frustrating to see that others are not listening, they're not following the recommendations. It's frustrating for many people, in fact. Many people who are seeing that some people are not following the rules.
Listening to medical advice and staying home for their safety, to watch other people out there putting not just themselves at risk, but everyone who is staying home at risk as well.
Merci beaucoup. On va maintenant passer aux questions par téléphone. Modérateur, c'est à vous.
Thank you, merci. The first question is from Brian Lilly of the Toronto Sun. La première question est de Brian Lilly du Toronto Sun. La parole est à vous. Please go ahead, sir. Your line is open.
Prime Minister, I'm wondering if you can tell us, you keep being asked about the Emergencies Act and you seem hesitant. Why are you hesitant, and what extra powers would the Emergencies Act or Quarantine Act give you that you currently don't have?
The Quarantine Act is already in place, and it gives us significant tools. One of the key elements of the Emergencies Act is that it is an override over the provinces. It takes powers that are normally only in the hands of provinces or even municipalities and puts them at the federal level. That's why we've been working closely and coordinating, watching closely as provinces have invoked their Emergencies Act, which has been an important step in fighting the spread of this virus. It's also why we will certainly be talking about the Federal Emergencies Act at the Premier's meeting this evening to make sure that we all understand what tools each different order of government has and where we might need to do more.
Thank you, merci. La question suivante est de Hélène Buzetti, Le Devoir.
Hélène Buzetti, Le Devoir.
Hélène Buzetti, Le Devoir. Please go ahead. La parole est à vous.
Oui, Monsieur Trudeau, justement,
Mr. Trudeau,
ordre d'idée, je sais que vous allez
along
parler
the same
à vos
lines.
homologues, mais vous
I know
allez
you've talked to your counterparts, but I'm sure you've already talked to them. Are any provinces asking you to, in fact, invoke the Emergencies Act? Well, no province has actually made a formal demand for the invocation of the Emergencies Act. That's part of our discussions, but given that part of the Emergencies Act gives powers that are normally at the provincial level to the federal government. Well, this is a conversation we have to have with the provinces, if that is to be done.
Thank you, merci. The last question is from Maura Forrest, Politico. La question suivante est de Maura Forrest, Politico. La parole est à vous. Your line is now open. Please go ahead.
Yes, thank you, Prime Minister. In the United States, California and New York have enacted lockdown measures at the state level. You're not ready yet to invoke the Emergencies Act, but would you support individual provinces enacting similar measures in Canada?
We know that provinces and cities are looking at what next steps they can take. We, of course, will support them in their decision-making, in the powers that they have, recognizing that many of them, if not all of them, have invoked the Emergencies Act at their provincial level. We will continue to coordinate and make sure that they have the backing of the federal government where necessary. We will continue to monitor closely this situation, to work with experts across Canada and indeed around the world on everything we need to do to keep Canadians safe. But even as we do that, with all the levers of governments and regulations and powers, fundamentally it comes down to citizens making smarter choices, choosing to stay home, choosing to self-isolate, choosing to keep their distance from each other, not going out and putting at risk people who have to be out for essential reasons in our hospitals, in our food supply, in our pharmacies. These are the things that people need to be doing. These are things, unfortunately, that not everyone is doing yet, and it is why it is so important for Canadians to step up and do what they can, not just to keep themselves safe, but to keep their neighbours and the rest of us safe as well. Merci tout le monde.
That is the Prime Minister giving his daily brief to Canadians. This is the 8th day in a row that he's given this national address and taking questions from reporters. Let's bring in our Ottawa correspondent, Mike LeCouture. Mike, the Prime Minister's tone really changed. Seems to be the toughest language he's used all week.
Yeah, it seems like he's a little fed up of seeing these images on TVs everywhere and on social media of people gathering in large groups, really kind of wagging his finger at them and using the strongest language, as you said, yet, saying if you choose to ignore the advice of social distancing, and he changed it also, because we've seen this, a lot of people using this now, saying physical distancing, keeping in mind that everybody needs to understand it's 2 meters away, 6 feet, however you want to put it out there. And, you know, these are the images that he's likely seen, and that frustration in his voice, saying if you choose to ignore that advice, you're not just putting yourself at risk, you're putting others at risk. And he mentioned that, you know, seeing these pictures online and these videos of people who think they're invincible, and his message to them, go home, stay home. This is what you need to be doing. Saying that every Canadian needs to do their part. And your part right now, everybody out there watching this and watching Prime Minister Trudeau, is to stay home, even though it doesn't feel that way. I can personally say in my neighborhood, it doesn't feel like we're in a state of emergency. Everybody knows it. But when you walk around, we're told you can walk outside, you can get some fresh air. Clearly, this is taking it to an extreme, and the Prime Minister said, this is it. Enough is enough. He needs to use this type of language to that end, announcing today that there's going to be an ad campaign with faces that people know. So we saw yesterday there was an ad that was sort of leaked out from the government of Dr. Theresa Tam, our Chief Medical Officer, underlying the fact that this is what needs to happen. You can expect other people, other known faces to be part of this campaign. It'll be on social media, it'll be on TV screens, it'll be everywhere. Prime Minister saying today, you will not have an excuse to say that you have not heard this message. And even in the end there, trying to help people understand, you need to do this, you need to stay home. And I think, you know, the government has already said, Patty Hajdu, the health minister, yesterday, underscoring the longer that you go outside and congregate in groups, the longer we're going to be in this situation. So if everybody just stays inside and does their part, maybe we can end this sooner. And the Prime Minister asked again, at what point do you have to bring in the Emergencies Act? At what point do you have to bring down a heavier hammer in the Quarantine Act to, you know, put in fines, to tell people you'll be arrested? And he's saying, we don't want to do that yet. We want people to heed the advice. But clearly he's getting frustrated. Clearly he's going to have conversations tonight with the premiers, as he mentioned, and seeing what they're doing and whether or not it has to be a complete national ban on going outside.
Let's talk about that conversation that he's going to have with the premiers. There's been no formal demand or formal request for the Emergencies Act to be invoked.
Not yet, and you've seen different provinces doing what they have to do, limiting the number of people number of groups that can be outside. It goes from any number of, it had been at 25 to 10, 5. We're hearing some places 2, making sure that people have that kind of social distancing. The report yesterday outside, out of Quebec, somebody who was in quarantine, who was seen to have been walking around the neighborhood, was under arrest. The Prime Minister doesn't want to have to play that card. Think about it this way. The government understands, and this Prime Minister understands, that's his last card to play. You don't play it yet, because you have to get to the point when it is extreme. He doesn't want to have to invoke martial law. He doesn't want to have members of the military or police forces patrolling, telling people, get back inside, hoping that we can flatten the curve by everybody pitching in. And that, I think, is why today, again, he's imploring people. He's practically begging people, saying, this is the advice. He doesn't want to have to use the Emergencies Act, but clearly saying, we'll do it if we have to. So I think that conversation tonight with the premiers will be key, because the premiers may ask him and say, look, we're doing everything that we can in our provinces. Nova Scotia has lineups of people that are coming over the border, and anybody who has come over the border into Nova Scotia is going right into a 14-day quarantine or a 14-day self-isolation. Because it's such a patchwork, I think tonight, after that conversation, you'll see more of a unified front, and possibly, could we see something tomorrow? It depends on how that phone call goes tonight, I think.
Okay, let's switch gears now and let's talk about the announcement that came out of this. The Prime Minister says he's going to spend $192 million to support drug companies and scientists. There's a real arms race now when it comes to to being the first to develop this vaccine for COVID-19.
Yeah, and I just spoke to somebody from the Prime Minister's office. That is part of the already earmarked $1 billion emergency fund for COVID-19. But today they're really just saying, look, this much is going to go there. When you heard the Prime Minister really mention all of the places that they're going to, that they're looking at, University of Saskatchewan, they're looking at different companies that they can lean on, how Minister Baines is actually going to be putting a call out to all post-secondary institutions and saying anybody who's got a lab, anybody who has anything that can help, 3D printing medical supplies and protective equipment. This is the stage we're at now. I think that the Prime Minister and this government sort of fleshing out and saying it's an all call now. Whoever can help in this fight needs to help, and it's reminiscent of what people have said. I obviously wasn't alive at that point, but during any world war, when every single company, every level of research is now put towards this effort. And everybody understands and knows that this is the battle, this is the enemy now, COVID-19, and they need everybody to put their efforts into this. And that's why part of this is going to be funding that side of it. He said, again, months away for a vaccine. So we need to make sure that everybody is looking for it, everybody is researching it and putting their efforts towards it, and figuring out who can get there first, as you said, a bit of an arms race.
All right, thanks for that, Mike. We're going to go to Jackson Prosco, our Washington bureau chief in D.C. Jackson, there was that $2 trillion stimulus package that the White House was trying to push through, but it didn't go through. What was the holdup?
Yeah, there's essentially political bickering happening here in Washington over how exactly this aid should be given out. And Republicans and Democrats are kind of divided over the issue of expediency. In other words, getting that cash to businesses, big and small, as fast as possible. And the issue of accountability. In other words, should those businesses face limits on how they spend that money? Should there be restrictions, making sure that they're not using that money for executive compensation, for example, that they're not laying people off if they're getting government assistance? So that has really held things up. And the fact that they couldn't get it passed yesterday sent the markets into a tailspin overnight. Dow futures actually hit the limit at which they had to stop trading in them, and they're down sharply again here today. And Robin, as all this political bickering, which is going to require votes from senators and members of Congress, takes place, there's another complicating factor, and that is late yesterday, the first U.S. senator tested positive for coronavirus, Senator Rand Paul, and he had been interacting with members of the Senate right up until yesterday. He'd been at the gym on Capitol Hill, he'd been in the swimming pool, and over the weekend had lunch with a good number of Republican senators. He is asymptomatic, but he was awaiting his test results while he continued to interact with all these people. Understandably, a lot of folks upset on Capitol Hill about that, and what this means is that not only is Senator Paul now in isolation and unable to vote, a number of other senators who had close interactions with him are also out of the mix. And so this is raising questions as Congress grapples with the idea of passing a massive aid package of do they need to look at other resiliency here? Do they need to find a way to make sure that these politicians can actually vote remotely? So, Robin, lots of layers to this, and it's not clear how fast this is going to get hammered out.
And on top of that, you have Washington, New York, and California declared disaster zones. We should note that New York has 5% of the world's cases, so this is very significant. The U.S. is number 3 worldwide in terms of the number of cases, and yet the Trump administration has been slow to react. That is the criticism around the world. Now, what is he planning on doing?
In fact, Robin, some fresh numbers coming in while Prime Minister Trudeau was speaking. More than 10,000 confirmed cases in New York City alone right now. That's why local officials there are looking at converting convention centers and arenas into temporary hospitals. And they're saying that that precious medical equipment is already running short, which is why they're ramping up pressure on the federal government. I will note that in recent days, New York's governor has had more praise for President Trump, saying it seems as though the White House is, catching on here. They're stepping up to the plate now. But there are still certain things that the White House is not doing. So they've authorized the deployment of the National Guard in New York, for example, but they're still not invoking the Defense Production Act, which is a wartime law that can essentially compel private industries to make things that the government needs. In this case, that would be masks and ventilators. And the White House has said, we're comfortable with the corporations that have stepped forward on their own to volunteer to make these things. A number of companies saying that they're quite happy to step up and increase the production of masks, for example. But all these things are sort of unfolding simultaneously here. And Robin, one other note I will point out when you talk about the White House, the stark difference in message coming from Prime Minister Trudeau versus President Trump. You heard Trudeau saying, enough is enough, go home, stay home. Well, today, down here, President Trump is openly musing that these restrictions are too much, and he's suggesting that maybe it's time to start lifting these restrictions in the near future and get people back to work, because he's deeply concerned about the impact this is having on the economy. He tweeted this morning that the cure should not be worse than the problem itself, and so I think that gives you a sense of almost the impatience here in Washington.
Well, that's what I was going to ask you next about these tough measures that we are implementing in places like Nova Scotia and Newfoundland and Labrador. There's talk or questions about whether we close provincial borders. Is there anything like that happening down there?
Not right now. President Trump has been asked about this repeatedly, whether it's time to restrict domestic travel. He has hinted that's a card that he could play at some point, but then you see the tweets today and you come to think that there's no way that's going to happen. So instead, you're seeing individual states take up more and more restrictive measures. While we've been on the air here, Maryland, just outside Washington, D.C., is shutting down all non-essential businesses. They're shutting down beauty parlors and salons. They're doing everything they can to keep people away from each other, but other states are far less restrictive. We should point out that roughly 1 in 3 Americans, that's more than 100 million people, is now effectively under a stay-at-home order. We have heard nothing, though, of the likes of what we've heard in Canada in terms of prosecuting or fining people who break those orders. And so I think it's only a matter of time until things ramp up here and become more aggressive, especially if you continue to see an explosive growth in numbers like we're seeing just in New York State right now, and Louisiana now emerging as another hot spot as well.
All right, Jackson Prosco in Washington. Let's bring it home and go back to Ottawa to our Ottawa Bureau Chief Mercedes Stevenson. Mercedes, what did you make of the Prime Minister's announcements today?
Well, I think it was the change in tone that was the most remarkable thing there, Robin. We heard some announcements about more funding for things like research in terms of a vaccine, the 3D printing you were talking about, the trying to get everyone involved in science, fighting this together. But it was really his tone that struck me and how he chose to start. When he said enough is enough. Stay home. You saw that teacher side of Justin Trudeau where, you know, the class has been asked to settle down and take their seats. They're not doing it. Next up is going to be that you're kicked out of class, you're suspended. And that is what I think you're seeing is the federal government asking people to do this. They're no longer asking, they're telling them. And you have a sense that if that doesn't happen, there is going to be a very serious consequence. And that could be declaring the Emergencies Act. And the fact that the Prime Minister went so far as to reveal what he's going to be talking about on the call with the First Ministers, the Premiers later today, that will include the Emergencies Act and how they want to approach this. That's very important because the Emergencies Act, as he said, overrides the provinces. It actually allows the federal government to seize provincial jurisdiction. It gives them incredibly sweeping powers. The last time we saw this act invoked, it was called the War Measures Act, and that was during the FLQ crisis under Justin Trudeau's father. And there was quite literally soldiers in the streets. And you could see that again. You could see the military enforcing quarantine. So it's a very extraordinary step. It's one that the Prime Minister doesn't want to take lightly or easily or without the support of the provinces. But it is something that he's making clear, look, these are critical times. The next week or two are really when we're going to get a sense of how this is spreading. It's when experts say there's the most undiagnosed infections out there that can be spreading to people who don't even know that they have it. And so he's being very clear. That tone is telling you that the federal government is willing to take some very serious, very major steps that would change how we live. So if you think how we live now has undergone a significant change, you'd really see more than that if you're starting to talk about quarantine enforcement orders and the military getting involved.
One final question. What did he say about closing interprovincial borders?
So that's one of the things they're talking about too, is you've seen Nova Scotia has border checkpoints. Some other provinces have talked about this. They're asking people not to travel interprovincially, but the question becomes, when do you stop asking and start enforcing, and how does that work? Now, obviously, right now that falls more under the provinces, but if the federal government starts saying no one can leave, again, that is stepping on provincial jurisdiction, which means they might have to look at the Emergencies Act. I think the fact that they're being very clear, you know, don't leave your home pretty clearly means don't go to another province. So they are still giving people a chance to make their own decisions and stay home, but they are very seriously considering all of the options that are on the table. These are unprecedented times. We haven't seen anything like this before in Canada. We haven't seen a pandemic like this before. So very different times calling for very different and potentially extraordinary and very restrictive measures.
No kidding. All right. Thanks for that, Mercedes. Let's go back to Mike Lecouture. Mike, let's talk about the Olympics. Team Canada is not going to send its athletes if Japan does not delay the Tokyo Games. Is it appropriate to have the Olympics? That was the question thrown at the Prime Minister. What did he say?
Yeah, clearly he doesn't think so. He said that he has spoken to Prime Minister Shinzo Abe of Japan and saying that he's well aware of the pressure that is mounting around him and making sure that they either, if they're going to hold an Olympics, that it'll be safe for everyone. And he did say that, look, anybody who's holding an international gathering of thousands of people probably shouldn't do it at this point. I don't know whether or not he has said it as such to his counterpart from Japan, but clearly if Canada's not going, you know, and there's going to be a growing number of countries. We had mentioned earlier, Australia has already said it. The IOC says they're considering it now. This is the first time they've changed that kind of language and said possibly postponing it maybe to next year. But as we had said before, all of these international athletes plan their training not only to the month, to the week, but to the day that their competition is scheduled to be. So they cannot get into gyms. They can't get into swimming pools. They can't train properly. So the Canadian Olympic Committee making this decision yesterday and possibly trying to lead the rest of the world into it. And Prime Minister Justin Trudeau saying, look, no gatherings are appropriate. Let's not look far into the summer at this point, even though it is months away. He's saying these aren't appropriate. And if we're telling our citizens now that you can't gather and you should be inside and at home, well, then maybe Olympic athletes are taking the lead here and saying, that's it, we're going to shut this down for now. We're not going to the Olympics, and maybe the rest of the world will listen.
All right, let's just ask one last question, and that is about the Canadians still abroad. It seemed that the Prime Minister was encouraging as many people who are close enough to an airport that is still open to get on one of those commercial flights, but we still have ones that are stuck and kind of are relying on the federal government.
Yeah, and the key thing that different members of the government have said, travel.gc.ca, that's where you register with them. That's the only way that the government knows where you are and knows that you need to get out. He did mention in his press conference that he's talking to Ecuador, El Salvador. We heard earlier today that the Foreign Affairs Minister said he's having conversations with Foreign Affairs Ministers in Cuba, Uruguay as well, making sure that people who are trapped there know that they can possibly come home. There are 3 flights that are planned to Peru. They'll be operated by Air Canada. There's another flight leaving tonight from Morocco, another one that will be leaving on Wednesday. This effort to repatriate Canadians and get them home is just incredible at this point. You have different air carriers that are saying Air Canada, WestJet, Air Transat, Sunwing. These are now working with the government to identify where Canadians are and to make sure that Canadians will get back. And that's why the government is saying register with us so we know where you are and we can bring you home.
All right. Thank you for that, Mike Lecouture in Ottawa. Now, I just want to quickly recap what the Prime Minister announced today. $192 million will be directly supporting vaccine research here in this country. Justin Trudeau also announced a series of repatriation flights that will be bringing Canadians home. There will be flights from Peru, Spain, Ecuador, and more flights from Morocco. He also says the government is working to help get Canadians home from other regions. Today, the Prime Minister's tone changed a little. He said enough is enough and that staying home is your way to serve. He stressed that all Canadians must practice physical distancing, seems to be switching away from social distancing, and stay at home to limit the spread of COVID-19. Trudeau will be speaking to the premiers tonight to discuss how to enforce this physical distancing, and that conversation could determine whether the Emergencies Act is invoked. And tonight, Global News is broadcasting a primetime special on the coronavirus crisis. That's tonight on Global Television. In the meantime, you can find full details on globalnews.ca and tonight on Global National. I'm Robin Gill. Thank you for watching. We return you now to regularly scheduled programming.
This has been a special report from Global News.
Our grocery shelves, working in a drugstore, or providing medical care. And there are other essential jobs. People need to continue to do those. But everyone else, please stay at home. Limit or eliminate contact with people at higher risk, such as all those seniors who you love and people in poor health. Les Canadiens et Canadiennes doivent pratiquer la distanciation sociale et
social
physique.
distancing and physical distancing. This means that they have to stay at
à
home
moins que vous faites un
unless
travail essentiel.
they have essential work to do. For example,
remplir les tablettes à l'épicerie,
filling our shelves in supermarkets, working in pharmacies,
fournir des
or
soins
providing
médicaux et
healthcare
autres
services
travail
and
essentiel.
other essential work.
Limiter ou éliminer tout contact
Limiting
avec
or
des
eliminating
personnes
all
à
contact
risque
with
élevé,
at-risk people,
telles que les
such
personnes
as
âgées
seniors
ou avec une santé
or with
fragile.
people with a
Okay,
lower level of
so
health
today
is also
we
essential.
will hear from Dr. Tam, our Chief Public Health Officer, la ministre de l'Agriculture
The
et
Minister
de
for Agriculture and
l'Agroalimentaire,
Agri-Food, Marie-Claude Bibeau,
qui discutera du
who will be
soutien
talking
pour nos
about
agricoles
support for
et nos
our
producteurs
farmers and
d'aliments
producers
qui font un travail
who are
absolument
doing eminent
essentiel,
work for our
and the
country.
Minister of Innovation, Science and Industry, Navdeep Bains, who will discuss COVID-19 research that he is strongly supporting. And we have, of course, also available to answer questions, the Minister of Health, Patty Hajdu, Dr. Howard New, et aussi le président du Conseil du Trésor et le vice-président du comité de cabinet sur le COVID-19,
and the Vice Chair of the COVID-19 Cabinet Committee, Jean-Yves Duclos.
Hello, everyone. So globally, there are over 340,000 cases of COVID-19 in 189 countries. In Canada, as of this moment, there are 1,474 cases of COVID-19 and 20 deaths. The Yukon reported its first 2 cases, which were linked to travel. Tomorrow, repatriated passengers from the Grand Princess who remain symptom-free at the end of their 14-day quarantine period will be released from CFB Trenton. Passengers who tested positive for the virus and their asymptomatic contacts whose quarantine period was reset will remain at CFB Trenton until their extended release date. We've now tested over 102,000 people in Canada, which is an average of approximately 10,000 a day. Many of those cases were exposed to virus outside of Canada, but in addition, we are seeing more cases that are not linked to travel. Most concerning of all are the cases occurring among high-risk populations in vulnerable settings and communities. Pour protéger les populations vulnérables et éviter que la propagation s'accélère encore davantage dans les milieux à risque élevé, nous devons maintenir les mesures strictes de santé publique et de contrôle de l'infection, afin de mieux protéger l'ensemble de ces populations, ainsi que notre système de santé et toutes nos collectivités. Nous devons ralentir la propagation communautaire en respectant continuellement la distanciation sociale. Une des principales raisons pour lesquelles nous souhaitons retarder et aplatir la courbe épidémique est que nous voulons gagner du temps pour la recherche et l'innovation. Les scientifiques ont identifié le nouveau coronavirus il y a de cela à peine 3 mois. Depuis, le Canada a redoublé d'efforts dans un grand éventail d'activités de recherche, allant des solutions biomédicales comme le diagnostic, les vaccins et les traitements, aux sciences sociales et comportementales. Nous devrions être fiers que les chercheurs canadiens participent à cette vaste étude internationale de l'OMS appelée Essai de solidarité. Pour la COVID-19. Il s'agit d'un effort coordonné auquel participent de nombreux pays pour obtenir rapidement de solides données scientifiques. To protect vulnerable populations and prevent an even greater acceleration of spread in high-risk settings, we need to continue with strict public health and infection control measures. But to further protect all of these populations, as well as our health system and all of our communities, we must slow community spread through unrelenting social distancing. A key reason we want to delay and flatten the epidemic curve is to buy time for research and innovation to occur. It's been just under 3 months ago that scientists first identified the novel coronavirus. During this time, Canada has stepped up on a wide range of research, from biomedical solutions, such as diagnostics, vaccines, and treatments, to social and behavioral science. We should be proud that Canadian researchers are now part of the WHO large global trial called Solidarity, designed to rapidly gather data on the most promising therapies for COVID-19. It's an all-out coordinated push involving multiple countries to collect robust scientific data rapidly during this pandemic. So let's keep up the momentum and let's get this right. Everyone who is practicing social distancing and self-isolation is giving a chance for researchers around the world to work on novel solutions. Merci.
And thank you very much, Dr. Tam. Marie-Claude, je te donne la parole.
Merci. Marie-Claude, you have the floor.
Alors, je viens vous informer des nouvelles mesures que notre gouvernement prend pour aider les producteurs, productrices agricoles et aussi les entreprises de transformation alimentaire canadiennes pour gérer l'impact de la pandémie de la COVID-19. As you heard this morning, the Prime Minister announced 2 new measures we are taking to respond to the agricultural sector's immediate needs. Farm Credit Canada. So first, Farm Credit Canada, as we all call FCC, is receiving an extra $5 billion in lending capacity. This injection of credit will permit FCC to help farm and food business owners on a case-by-case basis with potential deferrals of the principal and/or interest portions of their loans or access to an additional credit line. FCC agents are standing by to help. J'ai le plaisir d'annoncer que Financement agricole Canada verra sa capacité de prêt augmenter de 5 milliards de dollars. Cette injection de crédit permettra à Financement agricole Canada, FAC, d'aider les propriétaires d'entreprises agricoles et agroalimentaires au cas par cas à différer le capital ou les intérêts de leurs prêts ou à accorder une ligne de crédit supplémentaire. Les agents financiers de FAC sont fidèles au poste pour aider leurs clients. Second, I'm also pleased to announce that all eligible farmers who have an outstanding advance payments program loan deadline on April 30th or earlier will now receive a stay of default for an additional 6 months. This represents a total of $173 million in deferred loans. For the farmers and food processors who are facing tight margins and a cash crunch, together, the two measures announced today will help keep money in their pocket when they need it most. Je suis heureuse d'annoncer que les producteurs agricoles éligibles qui ont un prêt venant à échéance d'ici le 30 avril dans le cadre du programme de paiement anticipé auront droit à un report de paiement pour une période de 6 mois additionnels. Au total, ça représente 173 millions de dollars en prêts reportés. Pour les producteurs et les transformateurs alimentaires qui sont confrontés à une réduction de leur marge de profit, à des problèmes de liquidité, ces mesures aideront à conserver l'argent dans leur poche alors qu'ils en ont particulièrement besoin. These are unprecedented times for our farmers and food businesses. I am in regular contact with the industry and my provincial and territorial counterparts, and our government is working around the clock to take all the necessary steps to deal with this crisis. Once again, I want to thank sincerely everyone in the food supply chain, everyone who, despite the concern, goes to work every day so the rest of us can have food to eat. During these times, we see just how critical they are to our country. Je tiens à remercier encore une fois tous les travailleurs à travers le pays qui œuvrent au sein de la chaîne alimentaire, qui vont travailler chaque jour malgré leurs inquiétudes afin de nous nourrir tous. Plus que jamais, on réalise à quel point leur travail est essentiel. Dites-leur merci.
So thank you to them.
Merci Marie-Claude. And now we'll hear from the Minister of Innovation, Science and Industry, Navdeep Bains. Nav.
Merci Christia.
Thank you, Christia.
Tout comme mes collègues, je tiens à exprimer ma gratitude envers les travailleurs de première ligne. And I'd also like to acknowledge our world-class scientists and researchers. And in particular, I want to acknowledge our Chief Science Advisor, Mona Niemer, for her outstanding leadership throughout this crisis. As Ministers Haidu, Anand and I announced last Friday, we have put in place Canada's plan to mobilize industry to fight COVID-19. And today, we're complementing those efforts with support to quickly mobilize Canadian researchers working on countermeasures to combat COVID-19. Fortunately, our country's research community is amongst the strongest in the world. Canadian labs discovered the Ebola vaccine and were the first in the world to sequence the DNA for the SARS virus. In 2018, our government invested the largest amount in Canada's history towards fundamental science. It is those researchers that we count on today. With that in mind, we've identified several projects for investment that are already underway from university researchers and others to respond to COVID-19. A natural partner in this regard is the University of Saskatchewan's International Vaccine Centre, or VIDO Intervac for short. As one of the world's most advanced infectious disease research facilities, it was the first facility in Canada to receive clearance to harvest a sample of the COVID-19 virus. And so we're investing $23 million to help the centre expand and renovate its current animal vaccine production facility to meet the standards required for producing human vaccines. This will allow the centre to produce vaccines for clinical trials as well to meet early production needs when a vaccine is ready. We're also investing $15 million to expand and upgrade the National Research Council's Human Health Therapeutics Research Centre in Montreal. This will allow the NRC to partner with researchers across the country to produce vaccines and therapies for clinical trials and to meet early needs for frontline healthcare workers when an approved vaccine becomes available. Now, as we spoke on Friday, Canada's fight against COVID-19 requires all hands on deck, and that most certainly includes the private sector. To make it easier for companies and research institutions to contribute to vaccine development, we've added a new stream to the Strategic Innovation Fund to be focused on the fight against COVID-19, and we've topped that fund by $192 million to ensure resources are available. We've identified new projects that will be prioritized under this stream to deliver direct support to Canadian companies for large-scale projects. Companies like Vancouver's Abcelera and Quebec City's Medicago. Medicago a déjà trouvé un possible vaccin à base végétable contre le COVID-19.
Against COVID-19.
Elle recevra des fonds pour accélérer ses essais cliniques, puis la production du vaccin.
And to accelerate the production of the vaccine.
Has already identified a viable plant-based COVID-19 vaccine candidate. So this funding will accelerate clinical trials and then production. Meanwhile, the biotech company Abcelera will use its rapid pandemic response platform to develop antiviral therapies for COVID-19 treatment and prevention. The aim is to begin clinical trials this summer. In addition to those two projects, we have just signed a contract with Blue Dot. The Toronto-based digital health firm was among the first in the world to identify the spread of COVID-19. They use artificial intelligence and a range of anonymized data sets, including global air travel, to correctly track the spread of the disease around the world. And our government will use Blue Dot software to support modeling and monitoring of COVID-19 spread and to inform future federal decisions related to the virus. Nous voulons agir le plus rapidement possible pour aider notre système de soins de santé et ses travailleurs.
And its workers.
With the measures announced today, and with the help of our industrial base and research community, we will do exactly that. Merci beaucoup. Thank you.
Okay, thank you very much, Nav, and we're now ready to take your questions.
Okay, as discussed, we'll do 3 questions on the phone first. 1 question, 1 follow-up, and then we'll come back to the room. So, operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, n'hésitez pas de faire étoile 1 sur votre téléphone. First question is from Tom Blackwell, National Post. Please go ahead. La parole est à vous.
Hi, this is, I guess, for Dr. Cam, and it's kind of a specific question, but in some Asian countries like Taiwan and Singapore and South Korea, they've had a lot of success in getting the epidemic under control by using sort of tried and true epidemic kind of detective work, the contact tracing and strictly isolating people. You know, in Singapore, they've recruited police into the contact tracing process, and they're using cell phones to track down people who've had contact with infected people. I hear a lot about social distancing, but not much about that kind of detective work in terms of identifying who's infected and who's had contact with them. I know that's done by local public health offices, but to your knowledge, is that still going on, or have we sort of given up on that and are just sort of trying to rely on social distancing?
Case identification and very rigorous contact tracing is still being carried out at every province and local municipality, local public health right now. That is still Canada's strategy. So if you have a traveler who's come in with positive diagnosis, all of those contacts are still being tracked. If you actually have a community cluster like the one in Vancouver, for example, that is linked to a long-term care facility, all of those contacts are completely tracked, whether they're families who go into the facility or staff or, of course, residents. And so absolutely, that is a very intensive piece of work right now that is still going on. We will continue to do this because we're still containing the virus as much as possible to flatten that epidemic curve.
1 follow-up?
Just as a follow-up, just a very even more specific follow-up. The Costa Luminosa cruise ship that docked in Marseille, I think, a couple of days ago, all those people flew back to the States and Canada, I think through Atlanta on commercial flights, and there's reports that there were a number of people with COVID-19 and a number of people that were quite severely ill. What sort of efforts, if any, have been made to sort of track the Canadians that came off that ship and apparently have returned to North America in the last couple of days?
So we work very closely with Global Affairs Canada because we are aware of Canadians on a number of cruise ships around the world. And so any time that Canadians could be exposed to coronavirus on any cruise ship, we will track that, we will get the manifest, and if they should be entering Canada, flag any passengers from those cruise ships in order to identify them. And that it could be any number of potential ships happening, but we are trying to trace those very vigorously.
If I could just say to reporters also, we can't hear you so clearly. So if you are teleworking, please speak close to the phone and maybe not into a speakerphone, but use your handset to be sure we can hear you. Thanks.
Operator, next question on the phone, please.
Thank you. Merci. The next question is from Lina Dib, La Presse Canadienne. Please go ahead. La parole est à vous.
Oui, bonjour. D'abord, une question spécifique à Dr. Tam. Pouvez-vous nous donner le chiffre exact du nombre de personnes qui vont rester en quarantaine à Trenton, donc qui sont ou bien malades ou bien ont été en contact avec des gens malades sur les 228, il va en rester combien après-demain?
How many people will remain after tomorrow?
Merci pour la question.
Thank you for your question.
Il y a maintenant 13
cas
de COVID-19
ils ont été identifiés
dans le groupe à
Trenton group.
Aussi, il y a 8 personnes qui sont les contacts proches.
Been in close contact with
les gens qui ont resté dans la même chambre,
for example, people that have stayed in the same room as those with COVID-19.
La date pour le départ dépendre.
Departure date will depend on the date at which symptoms first appeared.
Dernière date que les contacts sont exposés
when they had
en contact
exposed
avec
contact with someone who had COVID-19. It's a different question for every single case.
Okay, je comprends. Et,
I understand.
Oui, ma autre question, I don't know for for Minister Haidu ou pour Madame Freeland. I'll try it in English and whoever wants to take it. So in this conversation tonight with the premiers, what exact signs are you looking for from them to see if the situation is coordinated across the country and if Ottawa should or should not be stepping in?
Voulez-vous une réponse en français ou en anglais?
Would you like an answer in English or French?
It doesn't matter. Whoever actually has the answer.
Okay, non, mais c'est moi. C'est Christian.
I have the answer. Hi, Christian.
C'est une importante conversation.
This is an
Maintenant,
important
on est
conversation.
collaboration entre
We are working
le
in close
fédéral, le
collaboration
Premier ministre et les Premiers ministres des
with
provinces
the
et
federal
territoires est
government,
très essentiel.
the Prime
Comme le Premier
Minister
ministre
and
a
provinces
dit,
and territories, like the Prime Minister
il
said,
sera là pour la
he will be
conversation.
here
Et
to
c'est un
dialogue.
moment pour le Premier ministre de demander aux provinces
The Prime Minister
qu'est-ce qu'ils font
will ask
et
provinces
de quoi
what they are doing
ont-ils besoin.
and what they need.
Et aussi, je veux souligner une autre
I would also
chose.
like to highlight one other
C'est
point.
une opportunité très importante
It is
pour
an
les
eminent
provinces
opportunity for
d'échanger les
provinces
informations
to share
une
information
entre autres.
in amongst
Le Canada est
themselves.
une vaste
Canada
pays
is a very large
et
country.
la conversation donnera au Premier ministre une opportunité de
And our
partager ce qui
conversation and
se passe
dialogue will
dans
allow
chaque
premiers
province
and our
et
Prime Minister
territoire.
to determine what's
Et
happening in each
évidemment,
province and territory.
comme était le cas avec la conversation qu'on a eue avec le Premier ministre la semaine passée. On va parler de la possibilité d'utiliser les mesures d'urgence et on va demander aux provinces qu'est-ce qu'ils pensent de ça. Ont-ils besoin d'un rôle plus fort du fédéral?
Do they need a stronger federal role in all this?
Merci. Thank you.
Thank you.
The next question is from Lauren Garner from Politico. Please go ahead. La parole est à vous.
Thanks for taking my question. You all and the Prime Minister have all said that no tools have been taken off the table, including the Emergencies Act. Is there a chance Parliament will be asked to vote for this Tuesday and Wednesday of this week when you all reconvene?
Thanks, Lauren. It's Chrystia again. The Prime Minister has been very clear that the Emergencies Act is a measure of last resort that should be used only when all other tools have been exhausted. That said, he has also been clear that everything is on the table. I think the conversation later today with the premiers of the provinces and territories will be very useful in getting a clear sense of both what the situation is across the country and where the premiers feel they do or do not have the necessary tools in their own provincial and territorial toolboxes.
One follow-up?
And one follow-up on the border. Have you seen, as the new restrictions on the border between Canada and the U.S. played out over the weekend, did you see any cases where further clarity may be needed, any problem areas, or do you feel that it's been rolled out pretty smoothly?
That's a great question, and I don't actually have the hotline number here with me, but you will find it easily online. CBSA has very swiftly set up a hotline and a website that people can use if they are at the border and they feel they are engaged in essential crossing of the border and need some help getting across. So please look that up, and please, Canadians doing essential work who need to cross the border, please use that hotline to let us know if you are having difficulties.
Okay, so we'll go to the room for 3 questions before going back to the phone. Kelsey, Reuters.
Good afternoon. My questions are from Madame Bibeau. The first question is, you said last week that there's an exemption for temporary foreign workers to come to Canada. Most of those workers, though, that Canadian farmers employ are coming from countries like Guatemala and the Philippines, where the airports are shut or the borders are closed. I'm wondering how the Canadian government actually plans to get those workers here in time for spring planting.
So the part that falls on our government's responsibility is really to negotiate with these countries, and Guatemala is a good example. So Minister Champagne is engaging with his counterpart over there to get the right to have a flight going there and bring these workers. For the organization, the logistic around the flight, and the supervision of the application of the isolation protocol, it falls under the responsibility and the coordination of Farm Canada mainly, with the support of other associations throughout the industry.
Around CFIA resources, I'm wondering, we're hearing rumblings about concerns about the availability of meat inspectors at Canadian plants. Is there a meat inspector shortage at the moment, or have there been changes to how meat inspections are being done in light of the COVID-19?
There's a challenge around human resources at CFIA, mainly for our inspector. The whole weekend we've been working on it with the collaboration of our counterpart in the provinces and with the industry. We're still asking the industry to help us make the priorities out of the priorities. and we are already doing that. And we will have further conversation with the provinces also to see how we can share some inspectors, how we can just, ease the different inspections that are normally done from the federal and sometimes slightly differently from the provinces. So we are really in the mode right now to finding different ways to make it easier and faster. So, and we are also calling back inspectors who have retired recently.
Julie, CBC.
Hi, Julie Van Dusen, CBC. Ms. Haidu, the Prime Minister said today enough is enough. So if people don't follow the rules, as we've seen examples where they seem to be oblivious to social distancing and so on, could one expect the police or the army to be called in to enforce the rules?
Well, I think we've seen at every level of jurisdiction leaders more stringently asking Canadians, in fact, demanding Canadians to take these orders seriously. Various different jurisdictions have various different pieces of legislation that they can use to compel citizens to comply with the quarantine orders that are in place, or the closures or different measures that are in place. I think the Prime Minister has been clear that we will use every tool available, and we are looking right now at stronger tools for those people coming back to the country to make sure that people understand that this is not a nice to have in terms of people staying in their homes when they return from their March break or return as snowbirds or various other returns to the country. This is absolutely essential. And yesterday I said, I was very clear. And I will say that again, when people are coming back after international travel, it is essential that they don't stop for groceries, that they don't visit their friends or family on the way home, that they're not stopping anywhere, but going directly home and doing so safely. We are looking at ways that we can even provide transportation for people that don't have capacity to transport themselves in a way that's private. It is very, very important that people take this seriously. This is a very, very serious situation. I know we've talked a lot about the needs of vulnerable people, but let me remind you that the greatest age percentage that we're seeing who are infected with coronavirus right now are working age adults and can have very serious complications as a result of this illness. So yes, of course, the risk of dying is much greater if you're older or you have underlying conditions. But even for those people that are middle-aged, there are significant complications for about 15% of them. And that's way too high. And so we want people to take this seriously, and we will be looking at additional tools that we can put into place should we see no progress in the next little while.
So is it possible the police or the army could be called in? That's what I want to know. Is that down there as a possibility?
There are a number of ways that quarantine orders can be enforced, and those could include random inspections. Those could include, hotlines. There are a number of different ways that these kinds of things can be enforced, and we are looking at a variety of different measures should we take that step.
Thank you. Rachel, CTV.
Rachel Haynes from CTV. First question would be for either Minister Haidu or Minister Freeland. A lot of cities and provinces have ordered non-essential businesses like bars, salons, spas, restaurants to close down. Is the federal government going to issue a blanket order to close all non-essential businesses now?
I'll take that answer and then turn to Dr. Tam for why. But listen, the measures that we take have to be based on the epidemiology of the particular place in which they are imposed. You've heard my colleagues talk about the need, for example, for essential workers. It's very important that what we do is strategic and based on the presentation of disease and what we see as the epidemiology of that disease and how it's evolving in the particular areas that are under those measures. As a rule, the majority of provinces and territories have already confined social gatherings to under 50. I think some have confined them to less than that. People have closed, some provinces and territories have chosen to close down establishments that are considered non-essential. In our mind, these are all very good measures. I'll turn to Dr. Tam to talk a bit more about the work that she's doing at the Special Advisory Committee on trying to coordinate that across the country.
Well, I think there's absolutely consensus amongst the chief medical officers that people should stay at home and do social distancing as much as possible. And I think we've seen across the country now, all schools are closed from kindergarten to grade 12. And also in the area of mass gathering, as the minister has said, or gatherings, I mean, the description, some jurisdictions are very small, and their capacity to deal with a situation is limited. And for them, the gatherings might be lower than 50 that they would be sort of trying to prevent. Some of my colleagues, there are, of course, strong public health measures like quarantine acts, where you can engage peace officers as part of those acts to do some of that enforcement. But on the public health side, I know that my colleagues are engaging like public health inspectors who normally inspect restaurants, for example, is checking in to make sure if your restaurant actually stayed open, are you social distancing? Have you reduced, for some is you need to reduce your capacity by 50% in order to increase that social distancing. And others, depending on their context, have actually closed restaurants for a temporary basis. So there are ways in which you monitor whether people are compliant as well.
There are still some businesses, though, that do remain open because they aren't clear whether or not they are essential, non-essential. They're worried about having to lay off workers. What would you tell businesses now who are still open and need some more guidance?
So we are providing guidance in terms of how you maintain your workplace or business while social distancing. Observing hygienic measures and doing all of that. Some good examples are like grocery stores. So providing some guidance to those establishments because people do have to eat and they have to go there. But even as I was shopping this weekend, people have increased the distance between people as they're lining up and the cashier, for example. But we are providing that type of guidance to businesses. And so, I think all of us know that this is going to take some time for us to reduce and impact and level this epidemic. But essential services must continue. So those are absolutely critical. And in the other cases, depending on your local instructions on things like restaurants. But our advice in general is stop all non-essential aspects of social gathering.
And I'll just say that as we work through those essential spaces, one of the essential spaces that stays open is actually homeless shelters, as you know. And just today, there were guidelines posted for employees and for homeless shelters to protect their staff and to protect the people that they're serving. So clearly, there are many organizations that cannot shut their door during this time because they are providing an essential service to a group of people or another. But I think the message that Dr. Tam and I have been providing to Canadians over and over and over is, if possible, work from home. Employers, if you have a capacity to facilitate working from home, do so. And if you are, on the weekend thinking of going to a restaurant and it remains open in your jurisdiction, think again and stay home. We are asking Canadians really to conduct only essential business, going to the grocery store, going to the post office, going to the pharmacy, yes, going for a walk, but within a safe distance, 6 feet away from the next nearest person to you. And these are the kinds of measures that we all need to be thinking about every day, not whether or not a particular facility remains open, but whether or not we actually need to visit that facility for any reason. And is there another way that we could get whatever it is that we need delivered to our door, for example?
Okay. Thank you. Operator, back on the phone for 3 questions. 3 questions au téléphone.
Thank you. Merci. We have a question from Hélène Buzuti from Le Devoir. Please go ahead. Votre ligne est ouverte.
Yeah, to follow up on that, ministers, what do you think of, there are some municipal governments requesting still today that all their workers show up for work unless they can't find a solution for, taking care for their kids. Is that the right message to send when you're, a governmental body?
I will just repeat that employers should be looking for ways, when possible, to allow people to work from home, regardless of what level of government or what organization or what sector. Now, having said that, there are some services that cannot be provided from home. Bus drivers, for example, continue to provide public transit, although I know that many municipalities are looking at ways to make that safer for bus drivers, like having people enter in the back door and ensuring that social distancing is happening on public transit. Listen, there are some aspects of life that need to continue, and I appeal to all employers, regardless of who they are, to look for ways that they can allow their employees to work from home and or ensure that they're using the best possible guidance to protect their workers when they are actually providing essential services.
And as a follow-up, the Prime Minister mentioned today that there would be a publicity campaign launched sometime, I don't know when. Can you provide more details as to who would be part of it, when is it launched, and how much it's going to cost?
I can provide some of those details and not all of them. We will get you some that I cannot provide. We had an initial amount of $50 million for a national media campaign. We've been working on some of that product, but that hasn't stopped us from distributing information prior to the launch of this media campaign. We've got a number of different ways that we're communicating with Canadians, whether it's in social media, in print, in radio, etc., and much of that is running now. We will have additional messaging to Canadians launching late this week, early next.
Thank you. Merci. The next question is from Micheline Laflamme, Radio-Canada. Please go ahead. Your line is now open. La parole est à vous.
Thank you. Minister Hajdu, you were saying that the government could provide transportation for people coming back from different places. Can you give us more details? How does it work? How would you put that in place?
Thank you. This is one of those areas where I will quote my colleague, Minister Freeland, who said sometimes we're making decisions and planning the details afterwards. What we're finding is that some people obviously don't have private transportation from the airport when they're returning. And so we're looking at measures that we can put into place to make sure that they are not unwittingly coming into close contact with other people like taxi drivers or other public transportation riders. And we'll have more to say when we have those details sorted out.
Merci. Et j'aurais une question pour Madame la ministre Bibeau.
A quick question for Minister Bibeau.
Vous ajoutez une aide de $5 milliards aux agriculteurs, mais c'est un prêt. Donc, pour certains d'entre eux qui ont une situation financière très difficile, ce ne sera peut-être pas assez suffisant. Peut-être que la crise qu'ils vivent actuellement va les pousser à la faillite. Alors, comment croyez-vous que ce $5 milliards-là va pouvoir les aider?
Alors, les mesures qu'on prend pour les aider vont évoluer au fur et à mesure de l'évolution de la situation dans les prochaines semaines. S'il y a un secteur qui doit demeurer en activité, c'est certainement le secteur alimentaire en ce moment, et c'est pour ça que je fais toujours un appel important aux travailleurs du secteur alimentaire. Alors, en ce moment, l'information, parce que je suis constamment en contact avec l'industrie, avec les représentants de chacun de ces secteurs, ils ont besoin d'oxygène, ils ont besoin d'espace, donc la possibilité de pouvoir reporter les prêts. C'est plutôt un problème de cash flow, de fonds de roulement qu'ils ont en ce moment. Ce n'est pas des prêts additionnels, mais c'est simplement parce que dans les circonstances actuelles, ils doivent souvent payer leurs intrants de façon très, très rapide. Il y a un peu de retard, par contre, sur la réception des paiements pour leurs propres denrées. Alors, c'est plutôt une gestion de fonds de roulement qu'on nous demande en ce moment, plutôt que de nouveaux investissements et des prêts substantiels à long terme.
Prochaine question au téléphone, s'il vous plaît.
Thank you. Merci. We have a question from Sharon Kirky from the National Post. Please go ahead. Votre ligne est ouverte.
Oh, hi. Hi, thanks for taking my call. It's a question for Dr. Tam. Dr. Tam, today a drug company announced it was donating 1 million doses of hydroxychloroquine to hospitals to use with COVID-19 patients experiencing respiratory distress. However, the Society of Critical Care Medicine recently concluded that there's insufficient evidence to support the use of anti-malaria drugs for COVID-19. I'm wondering your thoughts on this. I mean, should we be sending malaria tablets into the hospitals if the evidence to support their use is weak?
Yeah, so absolutely we need the evidence before you can provide medication to people. We've got so many ideas from all over the world, many researchers saying, well, this drug might work or another drug might work. I think Canada is part of an international effort, and at the WHO and other international networks, where they've identified really a very vast suite of potential drug therapies and combinations of drugs that are already in existence, but being repurposed, if you like, for COVID-19 treatment. So the trial that I've just talked about, which is called Solidarity, ran by the WHO, was stood up really, really fast. And one of the key drugs that they will be doing a randomized clinical trial on is the anti-malarial drugs, hydroxychloroquine or chloroquine. So that forms one aspect of that. And I think given that Canada is now part of that network, there are actually appropriate ways at which Canada can be engaged and make sure that our patients who are receiving these drugs are doing it in the most scientific and safest way possible. So there are mechanisms. I also know that the regulatory authorities, Health Canada, the researchers, CIHR, they're all supporting these kind of efforts in different ways as funders of research, but also as regulators. It is absolutely essential that you do science-based treatment, because there are so many therapies in every single pandemic. Everybody has hundreds of solutions that they think might work. We can't rule out the fact that they don't work, but let's just prioritize the top ones that the world scientists think are important and then do proper trials. What I'm really impressed with is that this mega trial, if you like, globally, where numerous countries can join in, is set up in such a way that it makes it really, really simple to join. And then the results can be analyzed in real time. So I'm really excited about that.
And one follow-up, if I can. There are also reports that Canadians are trying to hoard these tablets, much the way they did with Tamiflu during the bird flu outbreak. Again, Dr. Tam, could I get your thoughts on whether this is a wise thing for Canadians to be doing?
My message is that you should not take medication without the scientific evidence. It can be quite dangerous. These drugs are not without side effects. In fact, they're quite significant side effects, and so that people have to be really, really careful about this. Don't do it. From a national sort of Health Canada perspective, they are the regulators, but they also maintain a very close link to the manufacturers and the supply and where that supply is going. So there are mechanisms to actually monitor, to see what the distribution looks like, and then be able to actually do something about it. So I think if there were signals of certain massive buyouts, etc., the manufacturers are actually being really, really responsible. If they're spotting some signal that supplies are going in a certain direction, there's a mechanism set up to ensure that that doesn't actually happen.
Okay, thank you. So we're short on time. We're going to do, in the spirit of equity, 2 more from the room and 2 more from the phone. Dylan?
Update on the provincial bulk buy. I think it was first talked about 2 weeks ago. I'm wondering if any equipment has actually gone out so far, or if that's intended for later, how you're going to prioritize these requests, and if you have any sorts of numbers on things actually going out the door.
I'll turn to Dr. Tam. She's actively involved in the special advisory committee that's looking at both the procurement side and also the distribution side.
We may sort of have to get back to you with the details, because things are sort of coming in and going out, and there are many different items on that list. But I do know that there's certain types of viral swabs for the test kit that have been distributed, as well as some of the sort of other personal protective equipment. But I don't have those specific numbers. But we can certainly get back to people. But certainly, I think we're getting more and more participation from different jurisdictions to look at a more of a bulk purchasing approach.
And just on the coordination of supplies, I've had many conversations with various ministers from across the country over the weekend, as you can imagine, about this very topic. And it does appear that there is reflection going on about how we best distribute those to both meet the preparation needs of various jurisdictions, but also the immediate needs of jurisdictions that are really struggling with particular outbreaks. And we're going to have to balance both of those. Obviously, each jurisdiction wants to be prepared, but we also know that there is a somewhat of a surge in certain areas, and we have to be also responsive to those needs.
And a question about data sharing. It appears there's a patchwork of data that the provinces are publishing. David Naylor has said that Alberta is the only one that's showing us aggregate data on zones, demographics, growth rates, the kind of stuff that the public needs and researchers need. Have you asked the provinces to release more precise data? And why is the FAC dashboard not that granular right now?
Yes, we have, and that ask continues, and we have offered resources to provinces and territories as well, should there be a human resource challenge in terms of getting that data to us quickly. That is one of the live discussions that's happening, and one of the areas that I hope the Prime Minister will raise with the Premiers this evening.
Yeah, I promised we wouldn't have lots of follow-ups, but yeah, that is something that Patty and Dr. Tam have been very focused on, and that the Prime Minister will certainly talk about in the call with the Premiers this afternoon.
Thank you, Mike. Global.
Okay, so if we have nurses and doctors all licensed in different provinces, say one province is super full with stuff, and you got the doctors, the nurses, there's no beds. Can we take nurses and doctors from other provinces? Do you have the ability to do that now, or what would be the situation where we could do that?
So this is actually part of the years of pandemic planning. We do have a framework, or the operational framework on mutual aid and mutual aid agreements. But it is up to, of course, we have different licensing bodies for different health professional groups. But each of them have actually thought about emergency situations and emergency licensing. So that is very much part of the strategy.
Follow up, Dr. Tam. Actually, if I just have the one, Minister Freeland, the carbon tax a week Wednesday goes from 4 to 6 cents a litre on gasoline, 50% increase. Is that a good idea?
I think our government has been very clear that this is a time where our first priority is protecting the health and safety of Canadians, and that's what everyone here has been very focused on. At the same time, we are very aware of the economic cost of fighting this virus and taking care of our health. And so that means we are thinking very carefully about our whole approach to what we are doing economically, both in terms of how we are supporting workers and businesses, and also what we are doing on the tax side. And you've already seen some action from the government.
Thank you, Operator. We're going to switch back to the phone. 2 more questions, and that's it.
Thank you. Merci. We have a question from Émilie Bergeron, Agence QMI. Please go ahead. Your line is now open.
Hi, my question is for Minister Hajdu. Yesterday, you talked about making sure all the directives are uniformized. Where are you in your reflection in terms of maybe closing the interprovincial borders?
Thank you. Yesterday, I talked about the need for a clear and coordinated approach. That doesn't necessarily mean that it has to be the same everywhere. It is based on epidemiology and the best advice of public health. In terms of advising around the closures of interprovincial borders, you know that some jurisdictions have done that based on their own particular situation. And I think Dr. Tam talked about that. In the Northwest Territories, for example, knowing that they have a very vulnerable healthcare system and a very vulnerable population. Those conversations are ongoing through the Special Advisory Committee, and I will give Dr. Tam a few moments to just speak about some of that conversation you're having around uniformity, around advice to Canadians.
So I think all of us agree around the Special Advisory Committee and the Chief Medical Officers that the time to really try and make a difference in terms of stopping the sort of propagation of the virus, or delaying and reducing its spread, is of paramount importance. But we also all agree nationally that protecting vulnerable communities is a key objective that we all would essentially practice. And so that means protecting the northern areas, but also, of course, the territories. Provinces and territories recognize that they are at very different epidemiologic situations as well. And that there may be quite a vast area of Canada that really hasn't seen anything but the specific introduction by travelers, which is why you're seeing some of these measures being done to protect some of these areas. I think there's also some underlying criteria or factors that may not be immediately obvious. Some of these measures might be temporary because they're coping with students, huge numbers of people coming back, for example, to a territory right at this moment in time. So some of these measures are just to cope with the influx as well by reducing the numbers of other people maybe coming into the territory. So they each have their very individual requirements. And so I think we're all very supportive of that type of approach, but recognizing that we have significant concurrence around essentially all of the social distancing measures and closing down schools and reducing mass gatherings, etc. So I think that, but the other aspect that all chief medical officers were concerned about was, of course, maintaining essential services, making sure the North has the medical essentially support that they need. They are fly-in, fly-out communities that must be maintained. And also the longer-term impacts, whether it's mental health or other impacts. Because if you start impacting social economic conditions, that can actually have a very severe impact on health. It's not the kind of decisions that can be taken lightly, but I'm very happy to see that people are actually being very decisive about how to protect their communities.
Question suivie, Émilie?
Yeah, about mental health that you just mentioned, what are the echoes you're getting about this, how it pressures people that already have mental health issues?
Well, I'm very concerned about mental health, and I'm very concerned about a number of other situations related to the fear and the anxiety that people are feeling. People are very worried and concerned, and of course forced into situations that they would prefer not to be. So yes, I'm very concerned about the rise in mental health concerns. We have very soon, we will have an announcement about a national app that people can download and use to support them in terms of mental health concerns that they have and being able to access supports through that app. And in the days to follow, I'll have more to say about that. It's a tool, at least, that people can use that will be free and that will be available to all Canadians. But I'm also concerned about the rise in domestic violence, the rise in child abuse, the rise in all kinds of situations that we know come when people are in extremely very, very stressful and very anxious circumstances. I have spoken with my colleague Miriam Monsef, who is the Minister of Women and Gender Equality and Rural Economic Development. I think I got that right. Wage, anyway, the Department of Wage, about things that we can do specifically for particularly people who are more at risk of domestic violence, and how we support families who are often now caught for 24 hours in a condo with multiple children who may be feeling enormous amounts of fear, anxiety, and pressure around the future, their future and their capacity to be able to support their families. These are real and live issues that we haven't forgotten about, and that we are working on every moment to try and come up with solutions to help people in this very difficult time.
Thank you, Minister. Operator, one last question on the phone.
Thank you. Merci. We have a question from Daniel Leblanc from the Globe and Mail. Please go ahead. Your line is now open. La parole est à vous.
Hello, this is a question for Dr. Tam. In the news release today, they say the Public Health Agency is the one that will be working with Blue Dot. Can you give us a sense of what you are looking for from the company and what information they are providing and the value of the contract?
Blue Dot is a company, and Dr. Cameron Khan is a colleague that we work with on an ongoing basis, actually. So there's a lot of innovative thinking in terms of how the applications that they have, but also not just the tools, but the incredible amount of expertise that's behind those tools can be used. So while some of the work has been done at looking at the international spread of COVID-19, we can potentially use this tool to look at, well, what's happening within the Canadian context. So that's some of the areas of focus.
Follow up? No follow up? Okay. Thank you very much, folks.
OK, avant de finir, je veux juste donner la parole à Jean-Yves pour 2 minutes pour conclure en français. Allez-y, Jean.
Rapidement, pour résumer la perspective des derniers jours autour de ce qui se passe sur les plans épidémiologiques, médicaux et santé publique, le mot-clé, c'est mobilisation. Vendredi, nous avons mobilisé le secteur industriel du Canada, un secteur considérable par des politiques industrielles et d'approvisionnement significatives pour faire en sorte que la lutte contre le virus soit une lutte économique aussi. Nous avons aussi beaucoup parlé encore ce matin de mobilisation sociale. Le Premier ministre a été très clair que nous avons tous, chacun et chacune, une responsabilité sociale pour nous protéger, pour protéger nos proches. Aujourd'hui, avec l'annonce de Mme Bibeau, nous mobilisons aussi le secteur agroalimentaire parce que la sécurité alimentaire, évidemment, fait partie des besoins essentiels des Canadiens. Et si je peux terminer en disant que nous mobilisons particulièrement aussi aujourd'hui le secteur de la recherche et du développement au Canada. Nous avons la chance au Canada de pouvoir compter sur un milieu scientifique extrêmement actif, renommé à travers le pays. C'est vrai à travers toutes les provinces. C'est vrai en particulier pour la compagnie Medicago au Québec et dans la grande région de Québec qui est un des fleurons de l'industrie biomédicale du Québec. Et nous savons qu'ils sont possiblement déjà en possession d'un vaccin pour vacciner les Canadiens contre ce virus. Ce vaccin de nature végétale peut être produit rapidement. Ce qui est tout aussi important avec l'annonce de ce matin, c'est que des 300 millions de dollars sont disponibles pour appuyer cette entreprise et d'autres entreprises pour accélérer les tests cliniques qui sont absolument essentiels, comme disait le Dr Tan, pour pouvoir ensuite produire et distribuer ce vaccin à grande échelle. Alors tout ça tourne évidemment autour de cette obligation que nous avons de ralentir et de réduire l'incidence de la courbe d'infection, mais les mesures annoncées la semaine dernière, celles annoncées à nouveau aujourd'hui, sont toutes cohérentes à ce niveau-là pour nous assurer d'avoir tout le temps et les outils nécessaires pour prendre soin de nous tous et des Canadiens.
Merci, Jean-Yves.